this patient came in for breathing problems, and we put him in the cage, and he was doing fine before, but the anxiety brought on this severe asthma, kind of like what you'd think would be an asthma attack. What it actually is older labs can get laryngeal paralysis, and you can hear he's just got a whistling wheeze in the front of his throat, and that's because his larynx, the opening of his trachea is very small, and he's having trouble moving air through it, and he's gagging because he thinks there's something in the back of his throat he has to get rid of.
And what happens is, in their larynx, which is right here in their voice box, they get paralyzed, and it closes off.
So here's the obligatory diagram you always have to see, but on the left you can see that's looking right down a windpipe, and that folds around it are the arytenoid cartilages and the vocal folds, and they usually get pulled open like you see on the left, but in a paralyzed larynx the trachea gets covered up, and you only have a really small hole there at the bottom for the poor animal to breathe through, and that's what's happening.
Let's just pretend like this tracheal tube is a trachea, and let's pretend like this is the larynx, and this is the opening of the trachea. These are arytenoid cartilages here, and as an animal or we breathe, the muscles retract the cartilages to open up and let the air down into the lungs, and then they close, and with each breath.
The owner says he comes out of these, but definitely the only treatment is surgery, so I'm monitoring real carefully after the IV shot of dexamethasone to see how he does. He's starting to move more air.
A surgeon will come and he'll tie back one of these arytenoid cartilages so it stays open like this. The only trouble is when they swallow, there's a membrane that covers this called the epiglottis, and that membrane, these will close and that membrane will cover it when they swallow. Unfortunately, if this is open like that, they could inhale food down there and get pneumonia.
You can see his gums are still somewhat pink, but his tongue's bluish. And he's just having a heck of a time moving air. After a few minutes, you can see his breathing's much better. I gave him the cortisone IV, and I didn't give him a bunch of oxygen because, again, sometimes putting him in the face in that cone will stress him. I didn't intubate him because if you intubate him, you have to take him off the intubation, and sometimes that alone will cause a problem. But you can see after just a couple of minutes, he's much better.
That was pretty hard to watch, wasn't it? Older labs and older large breed dogs can get this laryngeal paralysis, and what it is like I explained, is the slit. The trachea has these arytenoid cartilage apparatus that moves and opens up. In labs, the nerves don't work as well anymore, and it becomes a small slit, and they have this trouble breathing. Unfortunately, there's not an easy fix. There's surgery you can do, and you tie back one of the cartilages, and it has its complications, and some people don't have the money or want to put their older dogs through it. There's drugs you can use, but they will still have some attacks. The drugs are for anxiety. One of them is doxepin, and it will decrease the anxiety disorder, and the chance that those cartilages that opening will become a very small opening. But unfortunately, we sent him home on a couple drugs, and he did real well for a week or two, maybe 10 days, and then he had several of these attacks, and he had one really bad attack where he just wasn't coming out of it. But anyway, we don't have an oxygen cage at our clinic. We have a small one for smaller dogs. We do use oxygen mask, but with him, the owner said he came out of these, and I wanted to watch how he came out of them, how long it'd take him, so I had an idea what the owner would be faced with at home. So I wasn't doing that to be cruel. Because I knew we couldn't solve the problem without surgery, I wanted to see what the normal course of it was for him. And anyway, that was a hard a hard thing to watch, I know. The owners decided not to put him through the surgery because of age and expense, but not really just the expense, just the age and the complications. We've had a couple dogs that have done well with surgery, but they were a little younger when they had the surgery done. But those are all tough decisions we all have to make for the love of our pets, and it's never easy.